Thank you, Marina. At this time, I would like to introduce you to Dr. Jeremy Hess, the Director of the Center for Health and the Global Environment at the University of Washington in Seattle. Dr. Hess is a global report author and senior author of the U.S. Policy Brief. I would also like to introduce you to Dr. Renee Salas, who holds appointments at the Harvard Global Health Institute, Harvard Medical School, and Harvard Sea Change at the T.H. Chan School of Public Health. Dr. Salas is the lead author of the U.S. Policy Brief and is an author on the Global Report. Doctors Hess and Salas, I will turn it to you now to share your remarks on the 2021 Lancet Countdown Global Report and the companion 2021 U.S. Policy Brief.
Thank you, Tia, for the kind introduction, and thank you all for joining us today to mark the launch of the 2021 Lancet Countdown on Health and Climate Change and the accompanying U.S. Brief. A year ago, we came together to present the 2020 Lancet Countdown Report and the brief, to recognize the key findings and to consider implications for the U.S. From the depths of a pandemic year in which the World Health Organization estimates that at least 3 million people died from COVID, the 2020 report presented a mixed picture. The report noted great progress on health professionals engaging the issue, not only through research and efforts to address the mounting health impacts, but also through championing the health benefits of decarbonizing the global energy system, starting with the health sector itself. The report celebrated the steadily increasing investment in renewable energy sources, but lamented that the carbon intensity of the world's energy supply had remained constant for decades. It's a chemical dependence we can't seem to shake. The 2020 report also highlighted the pandemic, of course, and the need to pursue a recovery strategy that is closely linked with a strenuous effort to reduce greenhouse gas emissions. The report stated that unless the global COVID-19 recovery is aligned with the response to climate change, the world will fail to meet the target laid out in the Paris Agreement, damaging public health in the short and long terms. The 2020 report also outlined, quote, the emerging health profile of the changing climate, and noted the, again I quote, concerning and often accelerating trends for each of the human systems of climate change monitored. With the 2020 report presenting, quote, the most worrying outlook since the Lancet Countdown was established. That was, unfortunately, until this year. We come together now, as we have in years past, to consider progress since our last meeting. Unfortunately, there's precious little good news to report. The authors from 43 academic institutions and United Nations agencies summarize progress, or lack thereof, on 44 indicators, and report that the trends demonstrate a, quote, unabated rise in the health impacts of climate change and the current health consequences of the delayed and inconsistent response of countries around the globe. The 2021 report documents worsening trends in exposure to extreme heat, particularly among elders and infants. During any month of 2019, the report notes that nearly 1/5 of the planet's land surface was in extreme drought. Yield potential is dropping for all staple crops. These impacts are beginning to reverse decades of advances against food and water insecurity globally, and are felt most by the most vulnerable. This is disheartening to read, but more importantly, it's devastating to the people on the front lines, whose lives and livelihoods are directly threatened. The world's health inequities have been a familiar refrain in recent years, as inequity has characterized the response to both COVID and climate change. With regards to COVID, over 60% of people in high-income countries have received at least one dose of COVID-19 vaccine, compared with only 3.5% of people in low-income settings. Public health capacity cleaves along similar lines. Just over half of low-income countries reporting implementation of health emergency frameworks, compared to nearly all high-income countries. Along similar lines, only 52% of countries sampled in this year's report having a national adaptation plan for health. We know from our own experience here with COVID-19 and other disasters that readiness and capacity makes all the difference. The ongoing opportunity to leverage the recovery funds from the COVID pandemic to advance a transition to a low-carbon economy, which was highlighted in the 2020 Countdown report, is appearing less and less likely. It's good news that we're investing to emerge intact, but we could be doing it much more effectively as a long-term investment in health. In fact, the report states that, quote, the economic recovery from the pandemic is already predicted to lead to an unprecedented 5% increase in greenhouse gas emissions in 2021, and to bring global anthropogenic emissions back to their peak amounts. Such an overshoot would, quote, irreversibly prevent the world from meeting climate commitments and the Sustainable Development Goals, and lock humanity into an increasingly extreme and unpredictable environment. The 2021 Countdown reports that on the current trajectory, climate change will become the defining narrative of human health, and that narrative will be a lament. The 2021 Countdown report refers to its findings as a code red for a healthy future, and depicts a world afflicted by chemical dependence, in which the ravages of the disease are becoming apparent, and the need for rehabilitation is increasingly pressing. Our dependence is on fossil fuels. We stumble, we fall, laid low by heat waves, droughts, fires, and disease outbreaks, but thus far have ignored the advice to take another path. We continue to subsidize our own demise, opting for a shot to steady our nerves, not recognizing renewable energy is cheaper than it's ever been, and the opportunity cost of continued investment in fossil fuels is at an all-time high. The dependence has proven to be most stubborn in places that fossil fuels built, like the United States. Even high-income countries are burdened, as this year's US brief attests. I had firsthand experience with these impacts in our Seattle emergency departments during the unprecedented heat wave this past June. That event, which was virtually impossible without climate change, was the deadliest weather-related disaster our region has ever faced. We lost hundreds of people over 3 days. As a physician on the front lines, witnessing the human toll of these disasters, with each one, I wonder if we've finally hit rock bottom, a point at which we realize the costs of our addiction to fossil fuels are too high and finally turn course. Earlier this year, the latest IPCC report suggests we're inches away from that point, and the terrifying thing to me is the impacts on human lives could be much, much worse. I was incredibly proud of my colleagues who worked from day into night, into day again, as the heat stalked our region's most vulnerable. But it was also a very sad moment, not only because we lost so many, but because it gave us a very clear picture of what the future is likely to hold. As we head into COP26, we have another opportunity to correct our course. I wish the world's leaders courage as they head into this pivotal moment. And I thank you again for your time and your attention and your commitment to protecting and improving people's health. Back to you.
Thank you, Jeremy. When I was early in my training to be an emergency medicine doctor, I vividly remember the first time a patient crashed on me alone. In mid-sentence, he suddenly became unconscious. I froze for a few seconds. I knew the diagnosis and I knew what needed to be done, but I was alone in the room and I knew that I couldn't do it all. And that realization is what paralyzed me with fear for just a few moments. But then I quickly called for help, and the room filled and overflowed with people, all coming with the mission to save this man's life. And we did it together. With climate change on the stretcher, the room is filling at an accelerated pace. And as the room fills, the fear and paralysis that I inevitably sometimes feel about climate change dissolves when I look at those by my side. I know we will tackle climate change through unprecedented collaboration and coordination. The 2021 Lancet Countdown US Brief is supported by over 70 institutions, organizations, and centers who work at the intersection of climate change and health, coming at it from different perspectives. But we are all bound together in our common passion that action on climate change is a prescription for improved health and equity, tied into this immense international collaboration. The take-home message of this year's brief is clear. Climate change is, first and foremost, a health crisis unfolding right now in the United States. There is no safe temperature from a health standpoint, and every fraction of a degree matters for health and equity. These impacts can be subtle, like worsening allergies due to higher pollen, or a transient cough from poor air quality from wildfire smoke that has traveled across the country. But the impacts are also significant illness and death, like heat stroke and heat-driven complications of heart conditions, often in those who are the most vulnerable. Decades of racially biased policies have created inequities worsened by climate change. For example, restricted access to resources, poverty, and discriminatory housing policies force certain communities to be concentrated in high-risk wildfire areas or near major sources of harmful pollution, like highways and refineries, placing certain communities of color at increased risk to climate change. Climate change and our interventions to grapple with it harm health unequally and in sometimes surprising ways. Understanding this is essential to ensuring that we respond in a way that best protects and prioritizes health and advances equity. Our report focuses on extreme heat, drought, and wildfires, three closely related health threats that our country has increasingly experienced. But we look at these recent events also to illustrate themes. Extreme heat shows how climate change harms populations differently. Infants are an extremely vulnerable population, and they experience a total of nearly 22 million more days of heat wave exposure in 2020 with respect to baseline. Drought harms health in surprisingly broad ways. Drought compounds heat-related illness, increases risk of infectious diseases, worsens air and water quality, exacerbates mental health issues, and contributes to food insecurity, particularly in rural areas. Wildfires can harm health far from the origin of the event, showing how interconnected we all are in this crisis. In July of 2021, wildfire smoke from California's massive Dixie Fire reached as far east as Maine, contributing to the worst air quality in New York City in 15 years. Wildfire smoke may be up to 10 times more harmful to human health than pollution from other sources, and early evidence suggests it is more harmful to health at greater distances, perhaps due to chemical changes or a lack of recognition of harms far from the flames. We also must use research to predict where future health threats may arise so we can better prepare. The transmission potential of dengue was on average over 50% higher in the past 5 years compared to the baseline in the 1950s, and briefly rose above 1 in 2017. Meaning dengue could potentially lead to an outbreak on U.S. soil in the right conditions. While there are many important actions that we need, we spotlight on 3 focus areas for the Lancet Countdown. First, there must be a rapid increase in funding to protect people's health. Urgent investments in research and local solutions are essential to minimize the health impacts of climate change. But we have to use data to guide our actions. Air conditioning saves lives. It's estimated to have prevented approximately 48,000 heat-related deaths in the U.S. in older persons in 2019. But access varies across the U.S. by region, is inequitable, and unreliable. And the electricity used for it contributes to deaths from air pollution and further increases greenhouse gas emissions, a vicious cycle. We must take a multi-pronged approach, implementing solutions that are available today that are equitable, reliable, and sustainable. Second, we must account for the health-related costs of the burning of fossil fuels in decision-making. We can't make the right calculations and understand how action on climate change is good for our bottom line if we don't understand the true costs by updating the social cost of carbon to include health. Lastly, we call for the U.S. to rapidly cut greenhouse gas emissions by 2030 to the 1.5 degrees Celsius pathway. This is especially essential in areas suffering most from fossil fuel-related air pollution, and thus we call for at least 40% of these investments to go towards improving air quality in under-resourced communities. The U.S. contributed 15% of global greenhouse gas emissions from the burning of fossil fuels in 2019, and we must at least commit to our fair share. Bold, ambitious commitments at COP26 will be the greatest prescription for improved health and equity that the world can write. And this report calls on policymakers to write this urgent prescription before it's too late. Health and equity must be our guiding principles in this equitable transition away from fossil fuels, like understanding how factors such as electricity sources and availability of electric vehicle charging stations worsen health disparities. Dr. Elinor Ostrom, who won the Nobel Prize in Economics, said, "There is no reason to believe that bureaucrats and politicians, no matter how well-meaning, are better at solving problems than the people on the spot, who have the strongest incentive to get the solution right." I can think of no stronger incentive than improving health and accelerating health equity. And this is the common mission that binds all of us together who work at the intersection of health. So my greatest hope and inspiration from this year's report comes in the last page. The list of over 80 people who supported this effort, all standing side by side. I remain hopeful that our country and world will answer the calls laid out here and beyond and do what is needed at COP26 and across the United States. But no matter what happens, I know there will be plenty of work for all of us to still do. We can resolve fear and paralysis on climate change by standing side by side and getting to work on our common mission. So join us and let us model how we can galvanize urgent, unprecedented transformation through unprecedented collaboration to implement climate action as the greatest prescription for improved health and equity. Together, let's go.